Alrighty, good morning everyone, and welcome to our webinar. This is our first time doing this, and so we are hoping and praying that all the tech stuff works okay this morning. My name is Heather Quasanza, and I am the Director of Philanthropy for Community Supported Shelters. Joining me are my co-directors, Blake and Tabitha.
Tabitha Eck, Director of Operations.
Blake Burrell, Director of Community Impact.
So, Community Supported Shelters is an alternative shelter program whose mission it is to help the unhoused rebuild their lives through intentional community. We're based out of Eugene, which is roughly 2 hours and 100 miles south of Portland, Oregon. And we currently operate 14 distinct shelter sites with over 150 individual units. So, a quick overview of what we're planning to cover today. We're going to share a bit of our origin story and explain how our alternative shelter model fits into the shelter ecosystem. Tabitha will then describe our unique shelter design and the basics of our village infrastructure. Blake is going to provide information on the services our unhoused clients receive, and they start actually receiving those services the moment they walk in our door. And we're going to share the secret to our success in moving folks from the streets into housing. And then I'll wrap up our webinar by discussing how we can help your community quickly address unsheltered homelessness. And it's really not as hard as you may think. Throughout the presentation, feel free to put your questions in the chat. Our behind the scenes tech superstar Amanda is going to keep track of those, and we'll do a quick question and answer session to wrap up the webinar. So let's begin. So, community supported shelters, an alternative shelter origin story. So, right now, I'm going to just share a bit about community supported shelters. We've actually been around since 2011. Our organization started during the Occupy movement here in Eugene, and we first provided a hoop-style tent for a mother who was staying at the Occupy Eugene camp. From there, we started building what are now known as Conestoga huts. In 2012, we placed 29 separate huts at faith communities throughout Eugene and Springfield. And some businesses actually put some of our Conestoga huts on their property as well. In 2013, we incorporated as a nonprofit, and over the next few years, we opened and operated 4 Safe Spot communities that had up to 18 huts at each site. Space was provided by the city, but we had to rely on individual donations and grants to support our operations. During the pandemic, as you can imagine, the need for non-congregate shelters became pretty apparent, and the city and the county asked for our help to rapidly increase our numbers. So we were able to move from about 4 sites to over 14 sites in the course of 18 months, and that increased our bed count to over 140 individual beds at that point. So we operate what we call alternative shelters, which are city-sanctioned outdoor shelters that are primarily off-grid and low barrier. Other examples of this model that you may be aware of include car camping programs and tiny home sites. We know that there's no one-size-fits-all approach to ending homelessness, but this type of model seems to be really effective in our community. We follow the 3 Ps relating to low barrier shelters: partners, pets, and possessions. We allow folks to shelter with their loved ones, with or without fur, and we don't require sobriety. Our spaces really help to create the bridge between living on the streets and moving into more stable housing. We've provided shelter and stability to thousands of individuals over the last decade. Our program model was developed with the input of individuals who have experienced homelessness. We're proud that our staff, our leadership team, and our board are comprised of individuals who have actually resided in our shelter communities. Our team meets people where they're at and prepares them to live in the community and beyond.
So now for my part, Tabitha, Director of Operations. So I bridge finance and HR as well as logistics and facilities and all the operational pieces. So the hut, you may have noticed our unique model. I've worked with every kind of shelter their model is, from communal to individual, pallet shelters, tiny homes, and I am enthused about the Conestoga hut. It's an incredibly resilient model as well as very accessible. So these tiny little shelters give you about 60 square feet of living space. amounts to a small apartment. It gives you privacy, safety, security with that lockable door. It gives our clients a chance to feel that safety of their stuff and themselves and get that first night of sleep. That stabilization is essential. But the accessibility of this model, we produce these for under $4,000 with stuff you can get from a hardware store. And you, as many across the world have, could buy our hut manual and make these yourself. It's incredibly accessible from a price point, but also labor. We started with all volunteers. Those first couple of huts and beyond were created from the hut manual with pieces in an alternative space to shelter someone. We started small. As you can see, I think there's a video playing right now. Yes, as you can see, the volunteer hut crew right there in time lapse putting up a hut. The two end walls and the two floor pieces, they're literally puzzle pieces. Have traditional insulation in them. The cattle panel gives that rounded shape, and then you roll over a TPO, which is a traditional rubber roofing material, like what you'd have at a home. That's that final layer, and there you have a little tiny shelter right there. It's, again, the puzzle pieces allow you that resilience of taking them down, fixing pieces, replacing a piece, and then putting them back together. A very, very resilient model. The worst rehabilitation job I've ever done was about $500 with labor. You cannot say that about an affordable housing unit, which is what this models and resembles. And again, that volunteer labor is priceless. You can see there we can add things. So a storage box was a request from our client base. We found a way to add more creative storage. So there's all sorts of solutions as you grow and learn with the hut. You can adapt it to ADA. You can see there a ramp that we have on one of our larger models. And so from there, you have what goes in a hut. It's a little apartment. So you got the mattress, the frame, everything you would need for that first time, right? That first little apartment of what you need to sleep and start to stabilize and have that security of self and stuff. So those tiny home spaces. And then we put those huts in communities. That's the point, right? There's many models for shelter, but for us, it's about that intentional community, creating that space geography, like the physical space, but then also the humans. And communities can vary. Anywhere from 2 to 30 huts can come together to create a community. You see here in the picture, they're really centered around those shared community spaces. A 2-hut site is a perfect starting point for an organization that hasn't done shelter before. That's how we started. We're working with an organization up north. The city said no to using public land, but the churches said yes. So they're going to start with 2 huts here and 2 huts there, just like what we did. Down south, you've got neighborhood associations not really liking the larger hut sites. Again, they're going to go to the churches and start small and get that community buy-in. We had early buy-in from our city. Our very first site, the city said, yes, use this land, prove this model. And then when we rapidly expanded again, the city invested in us, going from the 4 sites to 14 sites, adding over 100 beds to our inventory over the course of that year. During that season of rapid expansion, we actually gave our hut manual to a manufacturer who rapidly produced the huts so that we could add these inventory beds. So starter 1 to 2 huts, all the way up to those 18 hut sites where you really need a fully engaged nonprofit to help you manage those sites. We do a lot to bring pieces into those huts, into those communities. So you see we've got the porta potties, the water. Sometimes you have to bring all the utilities to the sites, but we're centered around the humans themselves. They're engaging in community, working together to share resources like water, which is of a limited supply if you're bringing it in and out. Firewood for the wood stoves every winter. We need to heat, right? Once a month, they're going out and doing those things together. So a lot of really, really positive engagement at the community level. And that really speaks to the lived experience within our teams. Our maintenance team, the folks going in and doing those hard fixes on the huts, these are men that live in the huts right now. They're long-term residents of ours that have become employees and bring that shared wisdom to the job and that mentorship of others. And we see that translating across our agency. Our service team, which Blake is going to talk about, the manager of that team can literally stand in front of every client and say, I lived in a hut. Let me tell you how to do it. So on to you, Blake, all the human pieces.
Wonderful. Thank you, Heather and Tabitha. So my name is Blake Burrell. I'm our Director of Community Impact. And the section that I'm going to be speaking about is about the fact that it is more than just about putting butts in huts. And I love this because what it does is it strikes at the core of what we do as an organization, which is fostering community and providing supports for individuals to stabilize and move forward with their housing related goals. So we focus on intentional community and community engagement. So we host about 2 to 20 individuals in each of our safe spot locations. Those individuals can live in our communities for as long as they need to stabilize. So this is anywhere between 1 month to over 2 years. What we're really doing is trying to foster a safe environment for individuals to stabilize with other individuals experiencing homelessness, so that we can provide an opportunity for them to move forward with their goals, and provide wraparound services at a stable and secure location for accessing those individuals. So we have teams that are focused on providing 3 primary areas of services within our human services operation. So we have an access center team. This team is responsible for our shower, laundry, and clothing assistance program. We have outreach teams. Those individuals are responsible for alternative shelter management, community outreach, and basic needs assistance, going into each community and facilitating meetings with each safe spot on a weekly basis. Then we have a navigation team. Our navigation team is responsible for basic social service, specialized information and referral, and one-on-one case management. Each of these teams collaborate and coordinate to have a cohesive direct service model, and help individuals move forward with their goals as they work through our shelter program. So our services that we provide are pretty broad and pretty in-depth, and we'll talk a little bit about how we have an expansive service offering and how we've done that through various grant contracts and public and private partnerships. So this is what we do. This is what everyone on this call would have to do if you're exploring the shelter model, but we can walk through each of these elements. So our organization starts with basic day services, helping someone stabilize while they're on a wait list for our program, providing basic social service assistance, think things like phones, IDs, some of those basic needs like food and water while someone might be in an unsheltered condition. We have diversion services. So we have folks at the beginning of someone's shelter journey actually engaging in conversations with individuals to try to divert them from the shelter system. Then we move into alternative shelter services. Those alternative shelter services are at the point of intake, providing an individual with moving into a safe spot community, actually having an environment to stabilize and be sheltered. When they move into that program, they have access to all those day services, shower, laundry, clothing assistance, as well as supplemental nutrition programming, workforce development programming, and then immediately engaging in navigation services. As those individuals move through this program, our goal is really to identify those needs and make sure they're supported to enter into housing or into a more stable condition that they see fit. And then when those individuals leave our program, our wonderful development team prospected funds for us to be able to provide aftercare services focused on housing retention and support for when someone moves into an apartment. So our model is what we call housing focused. So this means that everything that we're doing is working towards helping an individual achieve their goals related to housing and mirror and model what housing looks like. So our Conestoga huts provide basic stabilization, give an opportunity, our programming gives individuals an opportunity to identify personal goals and exercise what it means to be accountable to those goals. We allow folks to live with roommates and kind of exercise this idea of what does it mean to share a kitchen space with someone? What does it mean to share resources with someone? We do monthly unit inspections, which prepares individuals for Section 8 inspections or other public sector inspections. We have relationships with the property manager. So we mirror what it would look like to have a property manager or a landlord. Those individuals get time to exercise that relationship. And then we have frequent engagement with housing-focused navigation, hoping to increase skills for retention and adequate housing placement. So our model, we really believe the key to housing is community. So community is key to positive housing outcomes. We live in a community with a shortage of affordable housing, and we focus on finding appropriate housing options within this environment. So our program has had positive housing outcomes of 37% between 2020 and 2024. So what we're looking at is about 1 in 3 clients have positive housing outcomes upon departure from our program. This is really exciting for us, and you can see all these smiling and wonderful faces. We have many individuals that have been housed through our program that come back and participate in helping clients understand what it really does mean to live in a safe spot and to stabilize. So we really believe that community engagement is the key to our success. And things that I think really matter in this is that we have less institutional oversight, which mirrors that relationship with a property manager. We promote self-sufficiency and autonomy, so individuals have an opportunity to invest in the place that they live. And for those really highly engaged individuals, we have opportunities for them to build pre-employment experiences and income-driven employment opportunities, where we do have a percentage of our workforce who are individuals living in safe spots, who are stabilizing, accessing income, still receiving navigation supports to move on with their personal housing journeys. So we are people helping people working towards their goals and needs.
So we don't do this alone. We work with a lot of community partners, including our local city and county government officials. We work with, you may have heard of the Cahoots program that Whiteburn here locally runs. Peace Health is our local hospital system. Pacific Source and Trillium are our local insurance providers. We work with Senior and Disabled Services. We work with SSBF, which is Social Supports for Veteran Families. This is not something that we do in a silo. We do this together. The entire community gets involved in supporting our clients. As an organization, we've proven that we can rapidly expand the number of shelter beds while still maintaining a high quality of care for our clients. And we're excited to share what we've learned over the last decades with other organizations and faith groups and municipalities to help others increase the number of individuals who are unsheltered in their communities. So we've actually created a consulting package that offers one-on-one support through every phase of the shelter creation. So if you're just getting started, we have a planning checklist that's going to help you identify the gaps and inform your next steps. We have an extensive library of resources that we've created over the years that include community handbooks and shelter policies, and we're really excited to share all that with you. If you decide to do consulting with us, you'll also get a copy of our Conestoga Hut manual, and we'll learn best practices for keeping the huts in a livable condition for many years to come. Our consulting services can be tailored to address your community's unique challenges and needs. So this is an example of what the planning checklist looks like, and everyone that's on this call today will get a sample of our planning checklist, just so you can see some of the things that we've thought about. Our clients, our municipal partners, donors, faith communities, neighborhood associations. We've had a lot of input into this planning checklist. So this is something that we've developed over the last couple of years, and we've had a lot of people help us figure out what it is that someone needs to know if they want to create a shelter in their community. What are the things that we didn't think about right away, and what are our lessons learned? And so this is something that we get to share with you all now. So our basic consulting package starts around $5,000 for municipal and state governments, but we work with other nonprofits, and we know that funding can sometimes be a challenge. So we definitely offer discounted rates for nonprofits and faith communities. And we're a nonprofit organization ourselves, and so all of the proceeds from these consulting services go directly towards supporting our shelter operations. So anything that we do here goes directly back into supporting all of our clients every single day. So what's next? We truly appreciate that you've taken the time to attend the webinar. And as a token of our appreciation, like I messaged, You're going to get a follow-up email from me that has a preview of our planning checklist, and then an invitation to attend a free one-on-one meeting with me. So if you have any specific questions about your organization or your community, or there's some things that you just want to address one-on-one to figure out if this sort of shelter solution is right for you, you get to do that. I'm going to chat with you, and it's going to be awesome. As we wrap up, I'm going to check with Amanda to see what questions you all have asked in chat. So it looks like Alan asked, how do we solve the hygiene issue and restroom needs? Tabitha, that is
Restrooms,
yours.
porta potties, you outsource those things to the professionals. Personal hygiene is a different issue entirely, and that really comes with relationship building, that community component. That's probably not something you're going to address day one when someone is first stabilizing and honestly just needs to sleep. But from an ongoing perspective, you're going to do that gently coaching, and you're going to coach through a lens of safety and sanitation. There are best practices. And what our folks need to be successful in the long run is exactly the same skills they need to be successful in their journey in a hut, wherever they are sheltering. We can build those skills, but you got to start with the relationship building.
Awesome. What other questions do you all have for us? Because we do have a couple minutes left here this morning.
You like the Jeopardy music.
I know, right?
Background Jeopardy music.
Next time we do a webinar. All right. So if no one has any specific questions, let's go. Let me attempt to click to the next slide. I'm going to end today's presentation with a quote from United States Representative Jan Jankowski. So there's a lot that happens around the world that we can't control. We can't stop earthquakes, we can't prevent droughts, and we cannot prevent all conflict. But when we know where the hungry, the homeless, and the sick exist, then we can help. So thank you all for not only attending our webinar, but for all you do each and every day for your unhoused neighbors. You're going to receive that follow-up email from me with a preview of our planning checklist. And then in the meantime, if you have any questions, you can email us at community@cssoregon.org. Or if you are super excited about this and want to give me a call, that's my cell phone number on there. It's 541-514-9335. Feel free to give me a call. I'm happy to chat with you directly today if you're really excited to get this started. We really appreciate your time, and we look forward to connecting with you all soon. Have a phenomenal day.
Thank you.